Okay. Well, the first thing I wanted to ask you was about Lawrence Tech's fifth college. We are adding a College of Health Sciences. Why was the decision made to do that, and what programs are going to be housed in that new college?
Thank you, Matt. Pleasure meeting with you, Mike, too, and I look forward to this conversation. Yes, big news. It's very exciting. As you all know, Lawrence Tech has been home for four colleges, since actually 1967. Our first college was the College of Engineering, and of course, that's the genesis of Lawrence Tech. And that college was founded in 1932, followed by, if I'm not mistaken, the College of Business, and that was 7 years later, followed by the College of Architecture in 1961, and then our last College, Arts and Sciences, was founded in 1967. So 56 years later, we are very pleased to announce the formation of the fifth college, our College of Health Sciences, which will continue the tradition of Lawrence Tech and preparing students for eminent jobs, eminent professional, high-paying jobs in areas of society needs. As you probably know, Matt, and maybe some of the audience, we have started this journey of starting programs in healthcare and health sciences in 2017 by forming our first program and department in health sciences, which was our nursing degree program, which graduated 2 batches already of wonderfully and eminently trained nurses who all got job offers before they graduated and are doing incredibly well. That program was formed through a partnership with Central Providence. And following that, we started a program in healthcare management at the graduate level a couple of years later. And then last year, I had the pleasure and honor with my colleagues here in Lawrence Tech to launch 2 new programs, which actually started right this fall. One of them is our physician assistant program, and the second one, which is a master's degree in physician assistant studies. And the second one is a very innovative and unique program. I think one of out of 18 in the country and the first in Michigan. And it's a master's degree in cardiovascular perfusion, a very hot specialty with significant need within the operating rooms across the country. And again, it's one.
And for people that don't know, those are the perfusionists are the people who operate heart-lung machines in open heart surgery, certain transplant procedures, and they're also involved in some of the most severe cases of COVID-19. So.
Absolutely, and their work is right before surgeries and or critical procedures happens with these ailments or during surgeries, and could last for many hours during the procedure itself and right thereafter. So, and again, that program is pretty much aligned with our motto of theory and practice and technological education. It's a great partnership between our health sciences department and professors and our biomedical engineering program in the College of Engineering. And needless to say, I think the whole point with Lawrence Tech starting programs in the health sciences is, again, making sure that we are, number one, addressing, of course, an area of significant need in society, in which there is dramatic shortage and continues to be. But as importantly, if not even more importantly, making sure that our healthcare workers within the fields that we are starting are very technologically savvy, because all of these professions within the healthcare and the health sciences going forward, and within the medical and healthcare professions in general, very much actually require the healthcare workers of the future to be able to deal with technology, use technology, and immerse their practice in technology, whether it's in the area of digital record keeping, whether it's in the area of robotic surgery, whether it's in the area of health informatics and bioinformatics, whether it's in the area of telemedicine, virtual and simulated realities, automatic diagnosis of MRIs, CAT scans, and X-rays, and so on. And it's becoming more or less with the immersion and incipience of great technological advances within healthcare, that healthcare workers, again, whether they're physician assistants, perfusionists, medical doctors, dentists, and others, are very well versed and comfortable with both the usage of technology innovatively and creatively within their practices, whether it's within healthcare facilities and hospitals, or whether it's in private practice. So the goal and the aspiration of Lawrence Tech, given our growth within the health sciences in the recent few years, is not only to provide for one more pipeline and means to produce these very much needed workers for the future workforce within healthcare, but also ensure that whom we graduate are very, very well technologically trained and savvy by the time they finish their studies in Lawrence Tech. And that will be the motto and the and what we intend to offer within our new college. We see an expansion, and we already have many more healthcare type programs on the drawing board that we are contemplating and or designing. And for every one of them, in addition to the ones we have, there is a very significant element of medtech training and education within each one of these programs to ensure that the programs are very technologically focused.
Mhm.
And
I
again,
was going to ask you, Dr. Sobh, what healthcare programs does this new college give us room to grow into? You know, what are the future plans for it?
we have many programs that we are thinking of and contemplating. We are thinking of programs potentially. And again, please do not hold me to this, but we have so many of them on the drawing board as we speak. We are thinking of innovative, technologically focused and rich programs within the areas of occupational therapy, potentially physical therapy going forward. We are also thinking of potential new program in pharmacy. We are also thinking of programming within the area of chiropractic and chiropractic studies. We are also contemplating doctoral programs in areas like clinical health sciences and health sciences in general. And we are also contemplating very specialized either degree programs or graduate certifications that are much needed by hospitals within the area of respiratory therapy and monitoring and neuro monitoring during surgeries. And there is more than that, actually, that we are thinking about. But at least these are things that are being contemplated, and they are in various stages in curricular design and market studies. But we are very confident that when we're having a conversation a couple of years from now, that at least 2 to 3 out of these contemplated programs and or certifications will already be in existence. The market needs are significant. Healthcare needs in general and the workforce demands this. And given our track record in graduating professionals with significant technology background and innovative users and producers of technologies within the various fields, we are very confident of a very bright future. The college will continue to provide a very rich environment for collaboration between these different programs in health sciences and care. And that's one of the reasons we decided to do this, to provide for the right structure, both curricular and human resources in terms of faculty working together from the various fields. In addition, of course, to making sure that these programs are in line with our interdisciplinary leanings in general in Lawrence Tech.
Mhm.
So we expect these programs to work with programs from other colleges, right? Areas like School of Business and Management, areas like Biomedical Engineering and Engineering, Computer Science and Arts and Sciences. And these programs, in addition to the existing ones, are intended to be very interdisciplinary, very technologically focused, and truly capable of producing graduates for the future workforce within medicine, healthcare, and medtech.
Okay, we have about a minute to go in the segment. If people would like more information on the new LTU College of Health Sciences and also all of our health-related programs, where should they visit?
ltu.edu.
Okay.